Welcome to our site. So if you've made it this far, there's a very good chance you're suffering from low back pain. Now if that's you, I feel for you. That's how I actually ended up in this profession. I got hurt with low back pain and the chiropractor here actually helped me. And so I know exactly how it feels. Now you're in good company because the number one thing we see is low back pain and the associated problems with it. And that's been true for the last 10 years. We're in multiple locations. So I feel like we've seen it all. But one of the things we find is that there's so many different types of and so many different causes of low back pain that just trying to get clear answers can be really difficult when you're in your position. So the whole point of the next step is to clear that up. Now we've seen people who have had back pain for the last 10 years and it's been on and off and it's gradually gotten worse. We see people who literally were fine and then they twisted to grab their car keys or they just bent down to pick up a football off the ground and their back just went suddenly. We've seen both those scenarios, but what I find is common is it's not necessarily the pain itself that brings people in. I want to say it's the way it affects their life, because when you have proper back pain, it's really hard to be happy because that's all you can think about. It's really hard to be present with those that you love or with work and the things that are important to you when all you can think about is your back pain. And what drives people to come in is that they're sick and tired of it. We see mums who they just can't get on the floor to play with their kids. That's why they're there. We see people who have worked their entire lives, have worked their guts out, they've bought a caravan and retired, but now they can't sit in their car for more than 20 minutes at a time, so there's no way they can go touring, and that's what they want help with. So when you come in, we want to answer 3 questions. One is, what's the problem? Can we help? Right? So that means doing a detailed consultation. Now, if we find that we can't help, then the first thing we're going to do is refer you to the appropriate person or the appropriate profession who you need to see for this thing. If we feel like we can help, then we want to go to the next step, which is an examination. So we're going to put you through a battery of tests to work out exactly what's causing the pain. We want to do orthopedic testing, neurological testing, muscle testing, functional testing, postural analysis. If you need x-rays, we want to take those. We want to do them on site so that it's quick and we give you answers as quickly as possible. So once we've got that, we want to be able to say, yes, this is a diagnosis and I can help, or look, unfortunately we're not going to be able to help in this case. I think you'd actually be better off seeing this person. They're going to be quicker, they're going to be cheaper, it's going to be more effective for you, whatever it might be. Now, if we can help, then the next step is going through what's it going to take. So we want to let you know, it's going to take this long. It's going to involve chiropractic adjustments, it's going to involve exercise, neuromuscular education, massage, trigger point therapy, orthotics, heel lifts, whatever it might be. We want to put together a detailed care plan, take you through it step by step so you know exactly what's got to take place in order for you to not only get back to the things that you want to do, get rid of the pain, but to also stabilise what's weak, strengthen what's weak, so that you've got a lasting correction, not just a short-term thing. Because the majority of the time people come in and see us, they're sick and tired of taking pills, or they had back surgery that didn't work, but they want to avoid back surgery. And then this is like a last-ditch effort. So we want to make sure that it's not just a relief, it's not just a flash pan success, but we give you a lasting correction. Now following from that, we then want to answer what's it going to cost. Because we've gone through all the work leading up to that, we've gone through the detailed plan, we can give you a very accurate idea of what it's going to cost you. And that way, you're now in a position where you can make an informed and educated decision about how you want to handle your back pain. I look forward to meeting you. If you have any questions, reach out to us. I'm going to urge you to make an appointment, make the first step, because that's really when it starts, to find out who you need to see and who's going to be most appropriate for you.